You are listening to Radio Maria Canada. We now present the Health Hub, hosted by Cathy Biase.
Welcome to the Health Hub on Radio Maria Canada, exploring cutting-edge health and wellness information and therapies, helping you to take your health to the next level. I'm your host, Cathy Biase, and I'm an holistic nutritionist and a professional cancer coach. My guest today on our show is the world-renowned expert in brain health, Dr. Robert Melillo, and we will be discussing childhood neurological diseases through the lens of epigenetics and integrative medicine. We will also be talking about the potential of integrative approaches that combine traditional medicine, nutrition, environmental changes, and therapeutic innovations for treating them. Dr. Melillo specializes in childhood and adult neurological disorders. A clinician, professor, brain researcher, and best-selling author of Disconnected Kids, he focuses on ADHD, autism, OCD, tics, anxiety, and other developmental issues. Dr. Melillo is dedicated to bridging brain function, behavior, and physical health. His innovative multimodal approach, the Melillo Method, has transformed thousands of lives. Join us as we explore his groundbreaking work and unique insights into the brain. We discuss, amongst many things, the foundational problems in ADHD, autism, and other neurological issues, and how they relate to the gut. Is it a gut issue? Is it a brain issue? Is it a combination of both? Why parents need to be cognizant of childhood milestones to identify key stages of brain development. This is very, very important. And it's something that was really brought to my attention by Dr. Melillo. But the indications that come from hitting milestones were far beyond what my understanding was. So this is a very important concept that he brings up, and why it's important to incorporate an integrative plan to address neurological issues. Please stay tuned with us. We will be back in just a few minutes to talk with Dr. Melillo.
You are listening to Radio Maria Canada. We now continue with the program, The Health Hub, hosted by Cathy Biase.
Welcome back, everybody, to the Health Hub. Please do follow us on our social sites. We are on Instagram, X, and Facebook, and we are at the Health Hub on all of those locations. Dr. Melillo, welcome to the show.
Thank you. Thank you for having me. I'm excited to be here.
Yeah, it's, we have a lot of conversations around brain health, usually circulated with adults on this show. Really looking forward to taking a deep dive with you when it comes to the health of children's brains. I think it's going to be a great show for parents as well. I think this is an enlightening area with all the conversation and all of the talk, and especially coming up in April, Autism Awareness Month. How did you get into this area of research?
I was always interested from the beginning of my career in rehabilitation and neurology and neuroscience. Those were always kind of the areas that I wanted to focus. And I wanted to, really combine that in a way and understand what were the root causes of many different really complex neurological issues. But really, in the 90s, as I was, in my practice, and Bill Clinton declared that the decade of the brain, And all of this brain research was coming out in all ways to image the brain in ways that we could never do it before in real time. It was really an exciting time in the neuroscience and neurology area. And we started getting a lot of information about what we called functional connectivity, meaning most problems did not have to do with damage or genetic mutation or some sort of, chemical imbalance, but really the way networks communicate and connect with one another. And that was all related to development. So, it's important to remember that for any adult, and if you're talking about brain health, that all of our adult brains started as children's brains, and that we know that, at least 90% or better of all mental health issues in adults start in childhood. So understanding the development of the brain and what kind of can go off track to create a whole variety of different learning disabilities, behavioral issues, and mental health issues, as well as the impact it has on the overall health of the body and the immune system and inflammation, and all of that is really interrelated. So for me, brain health means that the brain is really responsible for all of our health. And it gets that way starting from child development. So needing to understand and look at it from that perspective.
As someone who myself just touches upon, the understanding of the brain, I've done a touch of research and some reading about it. What seems to have happened in the time that I have been in integrative health space is that we are no longer separating above the shoulder from below the shoulder. Now, do you think that this integration of brain health within the whole integrative space has something to do with our understanding of neuroplasticity and also this revelation of the glial lymphatic system? Do you think that has really helped to push your research and your movement ahead?
Yeah, I think that you're right. And, partly the understanding that the brain can change. Norman Doge's book that came out, The Brain That Changes Itself, years ago, really changed a lot of people's perspective and brought the idea of neuroplasticity to the mainstream because, there's a lot of people out there that really have misconceptions about the brain or flat out don't understand really anything really complex about the brain and how it works and how it operates from a moment-to-moment standpoint. And people think, oh, well, we can't really change the brain, and the brain, once it's damaged, or, that it has to be some sort of physical damage, or that it's a biochemical issue. And really, that's not the way it works. So understanding neuroplasticity, I think, is very important. And I think the lymphatic system has been really important to understand from the standpoint of concussion and brain injury, mild traumatic brain injury, which also has come into the media a lot more because of sports and because of some of the more, stories that have been out there in the media and famous athletes that have struggled from, CTE and things like that. So I think both of those have brought it into the forefront a little bit more and understand that changing the brain is a little bit more broad than just giving people a pill or something or trying to talk to them. That the brain is a real organ and a thing, and it's a living, growing, and it can change very rapidly with the right type of input.
Does epigenetics play a role in brain health?
It's huge. I mean, it's foundational. The fact is there are very small percentage of brain-related issues are genetic, meaning genetic mutations. That's kind of rare, actually, and it's relatively obvious. But what we see is more epigenetic factors play the vast majority of the role in any sort of brain-related issue or, any issue related to in the body, autoimmune issues, any of those things. The idea that the environment shapes the expression of genes. And what's more important is that even the prenatal environment. So I wrote a book, my third book was really about what are the things that elevate the risk of a parent or a young couple. What are the things that elevate the risk of having a child with a developmental disability, which is obviously increasing at an epidemic level. So I wrote that book because a lot of people were saying, hey, we have one child that has a disability and we're afraid to have another. Is there anything we can do to lower that risk? So that's where I put that book out. And, really almost all of it is related to how you can influence gene expression. And we know that there's a lot of factors that really impact preconception, the expression of genes in the mother and the father and the parents before birth is even hugely important because, it's there when the child is being conceived. And the idea of epigenetics, we used to think that the only way we could pass on, certain traits to our offspring was if we actually had a genetic mutation of some sort. But now we know that epimutations, genes that are turned off or are methylated, that those can be passed on in the off position for up to at least 11 generations that we know of. So, epigenetics is a huge part and much more important than genetic mutations.
Yeah, with diseases, such as cancer, which is something I'm more familiar with, this whole idea of epigenetics is playing a much more vital role than I think 20, 30 years ago we thought. And for me, there's not just a hope because it's not just we're passing this on, we have no control over it. There's a hope, but yet there's a burden when it comes to understanding this. Do you find this when you're working with parents in your practice?
Sure, because now it puts the responsibility on you.
Yeah.
Or on, the individual person, because the idea that epigenetics, the fact that a gene may be not expressed or blocked from expression. Remember that a gene that isn't being expressed or a gene that's damaged, the end result will look very similar, right? Mm-hmm. The gene isn't being expressed in the proper way. And it affects the development of a protein, and that can affect a number of different things. The difference is that in a genetic mutation where the gene is actually damaged or deleted or, the wrong structure, we can't as of now really reliably change that or repair that. But epigenetics says that we can wipe clean the methyl molecules or whatever is blocking the expression of that gene anytime in our life, so that, we can turn that gene back on at any given time. And most of the things that turn off the gene are lifestyle, the way we live our life, what we eat, the medications or drugs that we take, what we do to our body, the amount of stress we put ourselves under, the amount of inflammation, the hormone balances, what we're exposed to in pesticides or in pollution or in plastics or in hormone disruptors. All of those things play a role in whether our genes become expressed, not just in us, but in in multiple generations of our offspring. So in that context, it puts a lot more responsibility on you, and it puts a lot more responsibility on the individual, but it also gives you control so that you don't feel like, well, it's a genetic mutation and there's nothing I can do, which is really has been the attitude and the way that most doctors and therapists have been trained, especially in regard to the brain and especially in regard to developmental issues. They've been told for many years that these are genetic issues and there's nothing you can do about it. And the truth is that that's not true, that most of these issues and mental health issues are not genetic mutations, but they are epigenetic, and we can change them and we can change the root cause.
So parents now are kind of caught in the crosshairs of the integrative space coming to full-on support by research. This play with the parents and it opens up a whole space to me as you're talking in my mind for proactive and preventative medicine, even within the mental health space. Is that on point, or am I not getting it right?
No, you're absolutely right. And you're right that, I think the information is now out there to move there, but, we're moving there very slowly because, let's face it, most of the media messaging is still dominated by drug companies who really aren't focused on prevention, they're focused on dealing with the problem after the fact and primarily just managing symptoms. They're not really dealing with, and most of the approaches in the healthcare world is really symptom management. But when you get into the functional or integrative world of functional medicine or functional neurology, prevention plays a huge role in that. And that was why my third book was about how do we prevent these developmental disabilities. I mean, ultimately, it's the only way to really change it, because we're seeing an epidemic rise of neurobehavioral issues in children and adult mental health issues that are really the same population. 20% of children have some diagnosable disorder, and so do 20% of adults. Is that a separate population or the same population that has never really been dealt with, and we've only been maybe managing it? I think it's the same population, and it's actually even a lot more than that. And so, the idea is you want to be able to, first of all, prevent it if you can, and then intervene early. And if you can intervene early and you understand really the high level neuroscience of what's happening to the brain, I think we can not only prevent things pre-conception or during birth, but also early on, so that, we know something like schizophrenia doesn't show up until the 20s. And there have been studies showing that if you look at siblings, and if people look at videos of siblings in the first 5 years, or even identical twins where one twin ends up with schizophrenia and the other one doesn't, you can identify early on just the way they move their body and whether they're able to sit up at the same time, that child is different, and that child ends up having schizophrenia 20 years later. If you could intervene at a child level, I would argue that you would prevent them from having schizophrenia when they're in their 20s.
So to make it clear, I think I've got this right with what you were saying. You don't believe that there is a rise in mental health issues. There is a more of a knowing understanding of symptomology that has not been applied to the generation before. So we're seeing virtually, or, within, percentages, the same number, but now we're able to identify it. Is that the case?
No, there's definitely a rise.
There is a rise.
There's definitely a rise in all ages. But what we know is that, the developmental trajectory, when it's altered in the first few years, it may not manifest until adulthood. So that, again, schizophrenia may not show up until the 20s, but it starts in childhood. Mm-hmm. Bipolar may not start till later, 30s, but it starts in childhood. But I'm saying that there's absolutely a rise at all age levels, at epidemic levels, really. I mean, autism went from 1 in 10,000 to now 1 in 36. And most of that is actually a real increase, not just we're recognizing it.
Not just diagnostic markers being changed.
No, we're not just changing it. And that's important, because that's the messaging out there. Because
it is.
Most people want, the job in medicine right now is more to just keep people calm and to not get them upset and to not, make alerts, which, that's why they tell people that, early milestones don't really matter in your children, and every child develops at a different level. It's not really true, but that's their messaging. And I think in the area of mental health, they're also messaging is more and childhood behavioral issues, that we're just recognizing it more. It's not actually increasing. And that's also because, the real opportunity in the market is to create some sort of gene therapy. But if there's not a genetic mutation, then gene therapy isn't really going to be a huge boon. And the fact is, there's no such thing as a genetic epidemic. You don't see a gene mutation, rising through the environment very quickly and changing people and causing an epidemic of something, like some mental health or behavioral issue like ADHD. It doesn't work that way. And so therefore, it can only be epigenetic, which means that it can only be more environmental and lifestyle combined with the way the brain is developing. And therefore, that it goes out of the realm of saying, hey, someday we're going to be able to modify this gene and change it.
Mm-hmm. And just as an aside, I mean, I know personally and have just read a little article on the rise of diagnoses of adults with things like ADHD. And whether do you find that this is in your experiences, do you find that this is happening as well, or are these just incidental things that I've come across?
Oh, no, there's a rise in adult mental health issues as well. And in those cases, you may see that if you really go into the history, because I work with all ages. And so when someone comes into me, let's say complaining of adult ADHD or anxiety, the first thing I do is go back to their actual birth and even pre-birth. What was their mother's pregnancy like? You know, what was the health of their parents? What were their parents' traits like? What were they good at? What did they struggle at? Did they have any disability? Could they have had ADHD at some point? But what we often find is that when we go and really go into the history, that this adult probably had signs and symptoms of ADHD as a child that just wasn't diagnosed.
Mm-hmm.
And now it's fully manifesting because most of these developmental issues are going to get worse with age. You don't outgrow them. They actually become more and more of a problem. And they actually, because it's the brain, they have more and more an impact on the whole person, on the whole body, on their immune system, on their behavior, on their diet, on, you know, how they self-medicate. So it really has a bigger and bigger impact on them as a whole.
Mm-hmm.
But I'd say that a lot of what we're seeing, you know, the real wave of ADHD in many of these neurobehavioral disorders started really in the early 80s. And so many of those kids in the early 80s are now adults. And so if they went unrecognized or undiagnosed, or they were able to manage it at a certain level, and now they're in an adult level where they can't manage it anymore, and now they're diagnosed with that. And I think doctors and therapists out there are better equipped now to really recognize it in adults as well, because it can be an overlapping, you know, in the past, I think a lot of adult males that ended up with ADHD were diagnosed with anxiety disorder or general anxiety disorder later on. And now that's being labeled more as ADHD.
Coupled with the hopes of and the findings and research, there's hope for these adults. They're not just getting a diagnosis and as an explanation of behavior, but they're also being led down a path where they can manage and reverse some of the symptoms I'm imagining.
Yeah, and that goes back to the two things you mentioned, neuroplasticity and epigenetics. Mm-hmm. But the majority of people in the messaging out there is really more one that, well, we have medication to manage your symptoms, and then we can do maybe some form of talk therapy to manage your symptoms. But there's not enough talk out there really talking about what is actually happening, what is the root cause, what is actually going on in the brain, how is that producing symptoms in our body. And even in the functional medicine world, the approach to brain health really, you know, is out there taught that it really starts in the gut and it starts in the body and it starts with inflammation, and then that impacts the brain. And from a neuroscience perspective, that's not actually how it works. It's actually the reverse. It starts in the brain. It starts with brain development, and it starts with alterations of the way that the brain is communicating with the body. And then that creates problems in the gut and in the body itself. And that leads to inflammation. And it's a two-way street always, but I believe the brain leads the way, not the body. And so again, in the functional medicine world, I think they're dealing more with trying to actually deal with what they believe is the root, and they're looking at functions, and they're not just trying to manage the symptoms, they're trying to actually, you know, improve functions. And that can be done. I mean, we do that, working with the gut, looking at food sensitivities, looking at inflammation, trying to use supplements to modify the immune responses is all very effective. But again, in most cases, I believe if there's, you know, any sort of behavioral issue or mental health issue associated with it, it actually usually starts in the brain, and that is actually the root cause.
That's very interesting, because I don't think I've ever heard anyone come out and say this. It's always a two-way street. The gut can be the source of impact to the brain and vice versa. But it's very interesting that you have come out and said that, because it gives you a starting point. And you've got, if you go with the concept that the brain is leading the show, it takes away some of the uncertainty as to where to start. So I think that's a very, very interesting piece of information. I've got so many questions that I want to ask you, but I think maybe we'll take a break right now. When we come back, we're going to be talking about milestones. We're going to be talking about the integrative approach and Dr. Melillo's method program that he has been using very successfully. We'll just be back in a few minutes, everybody.
You are listening to The Health Hub here on Radio Maria Canada, a Catholic voice wherever you are. To contact us and be a part of the show, email thh@radiomaria.ca. We now continue with the program. Here once again is your host, Cathy Biase.
Welcome back to the Health Hub. Dr. Melillo, continuing with the topic of the brain, leading the show, and we are dealing with children. We've brought up that things happen in utero. Why would you say that with respect to the development of the rest of the fetus and a newborn?
Sure. So let's look, for example, most people in the integrative functional medicine world believe that a lot of the problem starts with a leaky gut, that, somebody gets a leaky gut somewhere in their life, partly due to inflammation or eating gluten or something like that. And then that produces that inflammation, and then that goes to the brain, and that may produce something like ADHD. That's not really how it works. Well, first of all, very few people in the functional medicine world really understand the brain and how it works, and the brainstem and how it develops. And also, we start out life with a leaky gut. So we're born with a leaky gut. And most people in the functional medicine world don't really understand that, or they knew it, but they didn't really apply it, right? So that we know that a child is born, and when they're born, they're in a sympathetically dominant state, meaning the sympathetic nervous system, the fight or flight system, is on. And the parasympathetic system and the nuclei that regulates that in the brainstem is inhibited and shut off. So the sympathetic nuclei in the brainstem in an area called the medulla is on at birth. And this is the way it's supposed to be. And the gut is open and leaky. Why? Because babies aren't producing antibodies yet. Their adaptive immune system won't develop till later on in that year or even beyond. And so they're not producing antibodies, and they need antibodies, and they get it from the mom's breast milk. And so that's the way they're supposed to get it. So their gut is prepared for that. And so the antibodies are really large proteins, immunoglobulins. They wouldn't get through a normal closed up, mature stomach lining. So for that purpose, that's the way it's supposed to be. They're also not producing acid and enzymes at that point, because those acid and enzymes would digest and kill those antibodies in the gut. We don't have a lot of blood flow in the gut because we don't need it. We don't have a lot of movement in the gut in an infant because we don't really need it. But then as the brainstem matures and other things are happening, as the child's going through their milestones in that first year, as they're inhibiting these things called neonatal or primitive reflexes, and as they get through that, as the baby starts to be introduced to solid food, which is usually around 6 or 7 or 8 months, and as they start producing their own antibodies, now what happens is the main parasympathetic nucleus in the brain stem comes on. It inhibits the sympathetic one that activates the other parasympathetic that controls the gut. And now the gut starts closing up. Acid and enzymes produce, and that creates the proper balance of the right flora, of the right bacteria that, kill any bad bacteria or yeast. The acid and enzymes now kill any other pathogens that may come with the food. Now the food starts to get broken down and digested properly, and we start extracting nutrients. So we need more blood flow to absorb those vitamins and minerals and amino acids. And we need to get more contraction in the gut so that we move it along so that the child is not constipated. Now, what is happening, and what we know, and we've done the research and other people, is that's not happening. That last stage, that parasympathetic nuclei isn't coming on, that the brainstem is not maturing. These reflexes are not going away in almost all neurobehavioral disorders, and that the child is still in this sympathetically dominant state. So they have a leaky gut. They're not producing acid and enzymes. They're not digesting food properly. They have malabsorption syndrome. They have constipation or diarrhea. They may have bloated or, gas or gut or colic. And that stays there unless you do something to change the brainstem and the brain. And then the left and right hemisphere regulate this ultimately, and they do a different job on that. And ultimately, those two systems is what regulates the balance in the immune system of inflammation versus anti-inflammation. So that's how it actually starts. And most people have no idea about that.
Well, it's confusing for parents. The introduction of foods much earlier than my generation. I don't know if that is an issue. Should we be looking at milestones before we introduce foods, before we do these so important things? Are there milestones that parents should be looking at, or can they notice certain brain milestones that they should be focusing on before things like introduction of food is taking place?
Absolutely. And that's one of the things I think is the key, because how do we know if the child has a leaky gut longer, or how do we know have this, persistent sympathetic response? We can look at things somewhat like pulse rate, or they can measure things called heart rate variability. But in an infant, those aren't always easy or accurate. But what we can see is what's happening with the milestones, which is a window into brain development. Because as the milestones are met, we're seeing the development and maturation of different levels of the brainstem and the brain. So the brain builds from the bottom up, like building a building. And it starts with the foundation, and the foundation is in the lower part of the brainstem. And this is where these early movements. So movement of the child is the most important thing to developing the brain. That engages the senses, and sensory motor movement and development and stimulation is really what activates the genes to build the brain. And we can see these milestones really pre-birth. So, there are pre-birth movements where the baby is supposed to get into the right position at the right time, upside down, backwards, deep enough down in the canal without the cord wrapped around their neck. If the child didn't do that, if they were in a breech position, if the cord's wrapped around their neck, if they're sunny side up, if they're not deep enough down the canal and the mom needs to be induced, right off the bat, I look at that is they're not meeting a milestone. And that's because these reflexes are not coming online, which means their brain may still be in a more immature state than it should be. And then if there's a C-section, again, that usually is because there's a problem with those milestones or something, or the baby's in distress, or we're not actually, and the reflexes should be used to go through the birth canal and then push themselves out, especially at the end. If they, aren't doing that, if they need forceps or they need assistance or they get stuck, then that also means that these reflexes may not be developing on time. And then the first milestone outside the womb is the baby should, if the mom chooses to breastfeed, the baby should be able to latch right away. Mm-hmm. If they're not fully latching, then that rooting and sucking reflex isn't there. And then there's a whole series of reflexes and milestones over the first year that should be met very clearly.
Did the doctors let them know this?
No, they're told the opposite, actually. As a matter of fact, during the pandemic, the CDC basically said that crawling isn't a milestone anymore. And they extended all the milestones much later.
But why? Is this for some dogmatic reason?
I don't know if it's dogmatic or it's more. And listen, I have pediatricians that I'm friends with. I have a pediatrician that's working with me, and I say to her, what is the messaging that you're getting? And they said, she said, first of all, I did learn primitive reflexes when I was in school, but I never looked at them, ever. And no pediatrician ever does. Pediatric neurologists look at them, but only for the first year, and they assume that they automatically go away. She also said, I don't, if they miss a milestone, I don't know what that means, and I don't know what to do about it. So, our messaging is just keep the parent calm and don't alert them and don't make them get upset and stressed out. It may just go away on its own, which it doesn't. But that's basically, they're just trying to manage the parent. And, quite honestly, they usually make the parent feel a little bit like they're being alarmist or overreacting. I mean, I had a mom that the baby had a stroke in the womb. And it really wasn't fully apparent until about 6 months. But the mom noticed, my child isn't using the right side of their body and they're slumped over in the chair. And the pediatrician, she brought it into him. He said, "Oh, it's not a big deal. It's fine. It'll even out." And then when they started crawling, they weren't really doing it. They only rolled over to one side. And when she was starting to crawl on her belly and on her hands and knees, she was dragging one side a little bit. And they didn't fully diagnose this until 18 months when they did an MRI. The pediatrician kept on saying, they'll catch up. This was with a stroke. Mm. Now, imagine most children don't have any damage to their brain. But to me, I have what I call a brain developmental blueprint, meaning the brain is one of the most complex things we know of in the universe. And you're going to tell me that there's not a very strict plan as to how to build that in the most optimal way? I mean, it's just haphazard. Like, even Einstein said God doesn't play dice with the universe, right? I don't think he plays dice with how the brain is built either. Like, yeah, it's okay. Some kids can crawl, some don't. Some skip crawling, some go right to. That's not the way it's supposed to happen. And we hear over and over that the key in childhood or even in mental health issues is early intervention. Well, the earliest intervention is to recognize that there's a problem. And I can recognize it from the very beginning when a child isn't latching. I know already there's a problem here. And we can intervene right then and there and actually change that.
Your program, I want to jump to your program because I think it'll kind of tie in all this. Your program is an integrative program. Can you explain to us how you pull all of the early developmental, the sympathetic versus parasympathetic, how it's all pulled into your program? Because, parents listening are going to want to know the environment to creating the healthiest brain that they can, before birth and infancy up to, continued development. How does your program work and how do you target these specific areas, these milestones?
Well, essentially, again, we're looking at how the brain actually develops and where it goes off track. And essentially, with all of our research, and we've done pretty extensive research, I've published over 100 papers. I have a PhD in developmental cognitive neuroscience, as well as a master's in clinical rehabilitation neuropsychology. So, I've looked at this and studied it my whole life and my whole career to try to understand what's happening in the brain and how it gets that way. And so we're looking at things from that perspective. Even in my adult patients, most of them have these things called retained primitive reflexes that should be gone by one. Right around 12 months, every child should really walk a few steps, be able to say a few words, and be able to point and have really good eye contact and not have any autoimmune issues or major immune issues going on, right? That should happen to everyone. If they don't, if there's some delay or alteration of that, then why? And the most common reason that we've been able to discover is it's related to these things called retained reflexes, which are related to epigenetic factors that may alter the expression of genes even before birth. And by the way, of our genome, 84% of our genes are there just to build our brain. So again, what's going to take the lead in all of this? And what is the epigenetics more? Just based on probability, the genes that are going to be affected more are the ones that make up 84% of our genome, right? And they happen to be the most sensitive genes out there. So, we start with looking at anybody. Do they have these reflexes? What's their history? Go back to their childhood. Most of these people have been struggling with things their whole life. and they've never related it to that. They've had gut problems their whole life, chronic constipation, gut pain, or when they eat certain foods, they have problems, or they have autoimmune issues. They've had eczema, they have asthma, they have severe allergies, whatever it may be. It often goes back to their childhood. And so we want to start there. So the foundation, we're trying to grow the brain and correct any growth abnormalities. In the vast majority of any of these issues, there is no genetic mutation. There's no injury to the brain. There's no severe metabolic disorder that's going on. There are these lifestyle epigenetic factors that alter the way the brain develops, and that affects our metabolism. And so, there's nothing really preventing us from changing this or even eliminating it completely. And the brain really takes the lead, and the brain is very complex, and the brain does many things, but it's an organ that grows and functions. And we don't think of it that way. We think of it as just more like chemicals, or that it just thinks, but it does everything. So we start with motor and sensory-based activities, and most of the problem has to do with imbalances and maturational imbalances that develop in the networks of the brain between the right and left hemisphere. The right hemisphere takes the lead in development for the first 2 to 3 years, and then the left brain. And that's where we set these differences between the right and left brain that are very, very important and critical to the human brain functioning at the highest level. We have the most lateralized brain. Anything that deviates from the development of the brain from the bottom up and top down, or from the right and left balance, is going to be the root problem. And so we try to identify that, and then we're putting together a multimodal program that combines motor activity, exercises, sensory stimulation, light, sound, music, smell. Smell is hugely important, and nobody ever uses it therapeutically or tests for it. We look at, different things like vestibular stimulation, eye movements. We use different frequencies of sound and light and music. We use different video games and virtual reality, stimulate different areas of the brain. We do different cognitive-based activities or exercises, or academics. We'll use something like neurofeedback. We use diet, nutrition, and really high-level functional neuroimmunology, as well as lifestyle management. And all of that is combined together to really direct it to create these balance and communication between networks in the brain and cause the brain to really grow.
Now, do people have to work with you one-on-one to get the benefit of what you're doing? Because, this would be of interest to many, many people, especially those who want to get on the preventative path. How does this work in relationship to the success of what people are going to be able to do with your program?
Yeah, all of my books have given people really a lot of this technology right into their hands in my book. My book, Disconnected Kids, which is one of the most popular books in the genre of, neurodevelopment since 2009. It's translated into 18 languages. Just came out with the third edition. It's published by Penguin, obviously the largest publisher in the world. And, in there is a book that not only explains what's going on in their child's brain, or may give them a window into their child's, their own brain as a child, but it also gives them specific things to how do they assess themselves or their child, or how do they put together a program that they can intervene. My third book, called Autism, the Scientific Truth, is really about understanding, these preconception and prenatal preventative things that you can do, and that you can look at these markers. It's hard to prove prevention. But in the book, what I did was I really identified 50 of the best and most well documented in the research risk factors that elevate the risk of a man or a woman having a child with a developmental disability, and what to do to be able to measure those markers and to lower them so that you can, in an objective, measurable way, lower your risk of having a child with a disability.
Have you seen results that have, as you said, preventative measures are hard to prove, but have you seen, we'll do it this way, what have been your most cherished successes with children suffering from autism or ADHD?
Well, from a preventive standpoint, when I first started doing this and putting together a program and then eventually put it into a book, any family I've worked with that had a previous child with a disability or something like autism, they did not have a subsequent child. So, and I think at this level, it's more than just chance that happened. So that, again, is not proof per se, but that's my experience that it works. As far as working with, all different developmental disabilities, but especially the focus of a lot of my practice in New York now is around non-speaking autism, which is really a fascinating area. These kids are super brilliant and everybody thinks that they're not, or doesn't think that they're there, or, it's really a fascinating area. We get incredible results with these kids where we can improve them, help them to self-regulate better. We improve their immune responses. But in many of these kids, and they ask us this, they communicate to us that they want to speak. And in most of those kids, we're successful at getting them to speak at some point, and some actually to a fully, normal level. But all of them, we have ways that we help them to communicate. And so giving a voice to a population and to people like that and what it does to their family, for me, that's the greatest reward in life for what I do. I love what I do every day because it's very, very difficult, but the rewards are unbelievable.
There's so many different veins of thought that I would love to go down the path with you. Unfortunately, we've come to the end of the show, but there's hope. And this is the big thing about what you're doing, correct? I mean, we don't want to end off the show with a burden for parents, but more of a hopeful outlook. And this is what you're projecting. So I want to thank you for being on the show and for, sharing your vast knowledge with us. Like I said, there's so many other things I'd love to talk to you about, but time prohibits. But I do really appreciate you coming on the show. And thank you so much for everything you do.
Oh, my pleasure. It was great speaking with you. Thank you.
Thank you. Everybody, we'll talk to you next week on the Health Hub.
You have been listening to The Health Hub, hosted by Cathy Biase, here on Radio Maria Canada.